Hi, I'm Jen. I'm a third year medical student at Deakin. Today we're at Box Hill Hospital as part of Eastern Health. Today you're going to hear from the clinical director and the clinical site officer and a few students about how good Eastern Health is and how good it is at Box Hill.
We're standing at the moment in the courtyard of the emergency department, and I'm an emergency physician and I work every Monday. But of course my substantive role is with the clinical school and making sure that you students get exactly the experiences that you want and need. Our values are to partner with students to create a joyous learning environment, and we believe that we do create that here. But you don't have to believe me. You're going to hear from our Year 3 and 4 students and also from an ex-Deakin student who is an intern currently at Eastern Health.
Hi, I'm Rachel. I'm a clinical site officer based here at Box Hill at Eastern Health Clinical School. Here we've got 6 clinical site officers, and my job is the primary officer for Deakin students across Years 3 and 4. During Year 3 you'll spend your time here with me at Box Hill Hospital, and across Year 4 you'll be allocated across all of Eastern Health. My role includes making sure all of your timetables are set, all of your placements are rusted, and also scheduling in all of your classes, so your lecture series, your bedside tutorials, any ad hoc teaching, exam prep, and your OSCEs.
Hello, I'm Kerry. I'm the Clinical Skills Coordinator, and we're doing a simulation at the moment with my boy Sam, the Sim Man.
Benefit of, in general, having small clinical teams and smaller groups of students on rotations, which means that you can get to know each other and the clinical teams really well. I think students here are very well supported by the medical student programs team. If you have an issue, there's always someone to reach out to, whether it's an administrative issue or something related to your learning needs. So I think students here feel really well supported.
So at the start of the day, you'll do a clinical handover, where the doctors will talk about the issues that have happened with the patients overnight. It's generally followed by a ward round, where you go and see each of the patients which your team is looking after. Depending on the clinical rotation that you're on, you'll then either go down to theatre, you might go to an outpatients clinic, or you might start ward jobs. And that may involve going and taking bloods, going and clerking a patient, or calling up other members of the patient's medical team. You might also have some scheduled formal learning, but if you don't, you can always use this time to go and do your own self-directed learning.
So first of all, you're really able to get integrated into the teams, especially in final year, and get to learn a lot of the jobs that you'll be doing as an intern. And this is due to there being not as many students, and also there being smaller clinical teams than at some other hospitals. And another thing that I think is really nice about Eastern is that you'll see the same people over and over again. And even as an intern, I've had people come up to me and say, oh, it's nice to see you working here as an intern now. I remember you as a student. So it's just quite a nice learning environment to be in.
We hope you've enjoyed our video of what it's like to be at Box Hill. There'll be plenty of opportunities to ask us questions. Feel free to send us an email or Facebook message us anytime. We really hope to see you next year.